When is the ovulation trigger administered during IVF treatment? This ovulation trigger is typically administered when ultrasound monitoring and hormone tests, including estradiol levels, have reached an appropriate size and maturity. This appropriate size is around 18 millimeters, which vary from clinic to clinic by plus or minus 1 or 2 millimeters, and maturity is a gradual development in synchronous way. And this appropriate size and maturity usually takes 8 to 12 days from the start of the ovarian stimulation. The timing of the trigger is crucial, as administering at the right time will give mature oocytes, and if it is administered too early or too late can affect the quality and the maturity of the oocytes. This ovulation trigger is usually administered as a single injection, either subcutaneously, that means under the skin, or into the muscle called intramuscular, depending on the type of medication one is using and the patient's preference. In most Western countries and some in Indian centers, you are advised to take the HCG injection by yourself because it is usually administered at night, and for this your fertility specialist or clinic will provide a detailed instruction on how and when to administer the injection and then to report it. Once the ovulation trigger injection is given, the aggressive schedule procedure is usually scheduled 34 to 36 hours after the administration of the ovulation trigger. The drugs which I mentioned earlier, that is the HCG or the GnRH, this 34 to 36 hours is crucial because during this time the trigger will allow maturation of the oocyte and then make them into the appropriate quality. And the 34 to 36 hours is important because if you try to do the egg pickup after 36 hours or later, you may not have any eggs. If you try to do it before 34 hours, you might produce premature oocytes. So doing the trigger and doing the egg retrieval at the appropriate time will ensure the best chances of success of your fertilization.